Good morning. Am I audible? Great. So we are starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for giving this divine science to all of us. Seeking blessings from our Guru, Dr. Prafull Vijayakar sirs, who have made this divine science and connected with the modern science and made it easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaraya Namah. So friends, we are reading Organon along with the Dr. Vijayakar fourth book, Verbatim. In Organon, we are reading the practical part of Organon, that is the case taking. And in yesterday's sessions, we have read about the wisdom of masters. So today we are continuing the part of case taking. Aphorism number 89. When the patient, for it is on him we have chiefly to rely for the description of his sensation, except in case of fiend disease, has, by this detail, given of his own accord, and in answer to inquiries, furnished the requisite information and traced a tolerably perfect picture of the disease, the physician is at liberty and obliged to ask more precise, more special questions. In previous aphorism, Master Hahnemann says that do not ask leading questions or suggestive questions which gives the answer in yes or no format. But again, when the patient has given a whole detail, so we have to chiefly rely on that, and then in that we have the process that we have to ask more precise and more special questions. If the physician feels he has not yet gained all the information he needed. So many a time nowadays, what we are doing that we need to find out the cause and effect relationship of each and every case based on the understanding of the Hammer's theory. That Hammer has given a general idea of that some mental conflict is arising to cause a physical disorder. So we need to ask a certain precise and more special questions to understand the patient in a detailed way. So this is what Master has advised to all of us. So in that at that time, what Master is giving an example specifically about the physical symptoms. So he has given a lot of example about how often is bowel move, what is the exact character of stool, is the vitis evacuation consists of the mucus and feces, or he had a pain or not during the evacuations and everything. So this is what he had given the generals, how to ask about the generals, ask about the sleep, ask about the stool, urine, perspirations, even during sleep. Is the person is what is the person is behaving during sleep? Is he whine, moan, talk, or cry in the sleep? Because these are the symptoms which is more important for all of us, and this is giving you a SSPU, that means singular striking and peculiar symptoms. So that is what a master is telling you, a more precise question to be asked on the basis of that. So these are the few example is there, and you have to go through this and you will get the idea that what question to be asked in the patients when you didn't get informations and you feel that the information is little lacking, so you need to ask more in this manner. So again, he has given about the thermals, hot and chilly, thirst. Also given about the excretion, the sweats, and what are the stage. Even he had given idea that in women, the note the character of the menstruations and other discharge also. So this is what very important aspect of understanding that when the patient is narrating his symptoms and he finishes, but still more further general symptom has to be taken into considerations. So that general symptoms help you to get the all the PQRS from the generals, and from that you need to enter into the case. So initial days of Dr. Vijayakar sir practice, he used to enter through the case, enter through the sensitivity like the riding carriage aggravation. He entered through the case in hunger aggravation. He entered through the case when there is a side affection. So this is what the general's idea of this understanding process will give a guidance. So it is the tool that we have to use in each and every cases. Then, in aphorism number 90, when the physician has finished writing down these particulars, that means all the general symptoms in a particular way, he then make note of what he himself observed in the patient. So here the master has given a very important aspect of understanding, that is observation. So most of time we get the history by the two ways. One is by the observation and another by the interrogation. So this interrogation process is finished, then we need to write the observations of the patient and ascertain how much of that was peculiar to the patient in his healthy state. So that is what you have to observe, the very PQRS things from the patient. So what he has given, so he has given the example that how the persons behave during the visit. whether he is morose, quarrelsome, hasty, lachrymose, anxious, despairing, or sad, or hopeful, or calm. So this is giving us idea that the person's dispositions, how the person is behaving over here. So that is why Master has given the importance to all of us that disposition is the most and chiefly in selections of the remedy. So that is why we have to keep everything in the notes. Again, what master is telling about in the observation that whether the person was drowsy state or in a dull state or in a dull of comprehension or whether he spoke hoarsely or in a low tone or incoherently or how otherwise did he talk. So again, it is very important to understand the state of the patient when the patient visit in the clinic. So what Vijayakar sir has given an idea in acute cases, whenever the patient comes to you, you have to observe the activity of the patient. If the patient become dull, if the patient is more sleepy, if the patient is hyperactive, if the patient having a more talkative, if the patient having verbal command has been increased, if the person having a physical has been increased. So this observation gives you idea that the state of the patient. Then also there was indication that master is telling about the color of the face, eyes, and the skin has to be observed. Again, the very expressions of the patient has to be observed in each and every cases. So that is the person's either a lively, vivacious, cheerful, or a person is sad and everything. So this is what the very expressions of the patient from looking into patient you have to observe. Then physically we have to observe the tongue, the breathing, smell, the mouth, his hearing, the pupils. So most of time whenever you visiting a ICU patient or whenever the patient is not so conscious, during that you need to observe this physical aspect also so that this physical aspect gives you idea about certain PQRS. If the pupil is dilated, if the pupil is contracted, pupil is reacted to light or not, what was the pulse, what is the conditions of the abdomen, the touch of the skin, either a moist or a cold or a hot. So everything what master has given a wisdom to all of us that you need to observe in the case, and then you can apply this knowledge into practice so that you will get the PQRS and you will get the remedy. Again, in case of whether he lay with the head thrown back, with the mouth half or wholly open, with the arm placed above the head or in the so this is what the positions what the patient is assumed during the visit. You have to observe. So these are the main important point that was given by master to observing each and every cases. In aphorism number 91, the symptoms and the feelings of the patient during the previous course of the medicine do not furnish the pure picture of the disease. अगर हमें कोई डायबिटीज वाला पेशेंट आता है तो फर्स्ट सिम्टम डायबिटीज में डिटेक्ट हुआ उसके बाद पेशेंट इज टेकिंग द मेडिसिन ऑन डायबिटीज सो वी डिडंट गेट द एक्चुअल पिक्चर ऑफ द डायबिटीज सो क्या करना है बट ऑन द अदर हैंड those symptoms and ailment which he suffer from before the use of medicine that has to be taken into consideration or after they had been discontinued for several days. यानी कभी कभी ऐसा होता है कि आप दवाई बंद कर दो temporary giving a placebo to the patient and then you will get the real picture of the disease, give the true fundamental idea of the original form of the disease, and this especially the physician need take note of it. When the disease is of a chronic character, so here very important aspect of it. Patient has been taking medicine up to the time he is seen. The physician may with the advantage leave him someday quite without medicine. That means उसकी दवाई बंद करनी है. Or in the meantime administer something of an unmedicinal nature defer to the substance period to the more precisely scrutiny of the morbid symptoms. So here the Hahnemann advised that in chronic cases when it is no danger to the patient, in that case you stop the medications of the patient and give a placebo to the patient and then observe the original symptoms in order to able to grasp their purity and permanent uncontaminated symptoms of the old affection and to form a faithful picture of the disease. So here he advised about the how to get the original unmodified picture from the patient in that case, especially in chronic cases. So this is the few wisdom word of Dr. Hahnemann to all of us and how we have to take care everything in our practice also. So in taking a case, we need to observe the patients and that is the most important aspect of our case taking process, and on the basis of that we can treat the patient with the ease. So what Margaret Taylor says, the well taken case is the half cure. If you take a case in a proper way, then everything will be easy. So now we are continue with the reading of the workshop Mahabaleshwar 2002, conducted by Dr. Prafull Vijayakar sir, and it is scripted in the form of verbatim. So we are continue with this process. So up till now, yesterday we have understood that everything is in a miasm form and everything has to be connected to each other. So we have to categorize each and every miasm in every way, either in the emotions, either in the intellect, either in the joy, either in the behavior. So everything is categorized and we have a little idea that you have to observe miasm everywhere. Now, furthermore, we are reading something from the cases that what Vijayakar sir has treated and how to apply just that knowledge into our practice. So this is what Dr. Prafull Borkar sir, who have studied with Dr. Vijayakar, and that Prafull Borkar has given an idea about the cases. So today we are starting with this day 3, chapter 9. When I sat with Dr. Vijayakar during my internship, I saw a case of psoriasis wherein the eruption disappeared from the below upward and he changed the medicines. So this is what the weakness of the prescription. I thought that this was a big risk to take. What if you do not get the result again? Most of time, a young doctor, budding neophyte homeopath, having the feeling that if the medicine has been given and some eruption has gone, and if you know that this is the wrong direction, immediately you need to change. But in the mind that if I will change and again it recur, what will happen? So this is what something happening in our mind. But he changed it. That means that he was a Dr. Vijayakar. He changed it and he got the result the other way. This was something I could not gather at that time. So this was the questions of Dr. Borkar. But over the year, I realized that this is a very important in the practice. So I will take today what I do in a skin cases. So this is what very important approach to the skin disease that was given by Dr. Praful Borkar and by the study of Dr. Vijayakar. When we treat the deeper disease like a thyroid, diabetes, cancer, joint pain, and we are happy when the skin eruptions come, we have brought the patient down to the level of skin. But now when he came to the level of skin, where we are going to send him. Sorry. There is nothing below the skin. We have reached the ground floor. Now what? Till that time we are happy. I neglected skin and never sit in the skin OPT because I thought the skin is not what I want to treat. Never sat with the skin specialties. Then I realized that if we are in homeopathy, whether other field comes into play or not, the skin comes in a very every patient. When I start treating these conditions, I found that it is much more interesting. I earlier thought that skin is a dry topic, but then I found it is more interesting. So, what do we do and how do we proceed in the skin cases? If our patient is there with us for a month together and nothing happened in the skin conditions, we have to find our solutions. So, let us see the difficulty that we face while treating the skin condition. This is not Dr. Praful Borkar's difficulty. This is the every homeopath's difficulty. So, that was what are the difficult point. Sorry. The obstinacy and the chronicity of the complaint being the most irritating factor. So most of time the patient comes to you with a very chronic eczema or a chronic disease like a psoriasis or a chronic skin condition. So we know that the disease is very obstinate and again the disease is of a chronic characteristics. Second point, a patchy and inconsistent result. Sometimes when we give a medicine, certain part the itching has been stopped only and again begin in the some other part. So this is what the patchy and inconsistent result. Most of time you will get these things. Again, in case of this, when to repeat and how long to wait? When will the reaction start? This was the most common questions comes to us when we are practicing in homeopathy with the skin disease. So if patient comes to you with more itching, then you have to you in your mind that you need to understand the follow-up in a right sense. If it is in the right direction, do not repeat, do not interfere. But many a time the insistence of the patients make you to repeat the case, and sometimes you may spoil the case with this unnecessary repetitions. If the two skin condition exist simultaneously, then which one should go first and which one later on? So this is what we have to understand in each and every cases. For example, the psoriasis and the vitiligo. So which one has to go first and which one has to go later on? So this you have to observe each and everything. How much the diagnosis is important in homeopathy? Is diagnosis is important in homeopathy? Absolutely. Because that diagnosis gives you idea about the process of miasm happening into the patients. So most of time we do not know what conditions we are treating as the patient has gone from one skin specialist to other and each one gives a different diagnosis, something which we have never heard of. We do not know what layer it is it in and how to proceed. So it is very important to know the anatomy and the physiology of the skin. The skin has two layer, the epidermis and the dermis. In epidermis there is a perical cell layer, granular layer and the horny layer. The horny layer comprises of the dead cells. The cells are generated at the level and go up in 5 to 6 days' time, they reach the top where they are discriminated unknowingly and unseen. Everyone has this discriminations. Very few of us can see it. The hair and the hair follicle originated from the epidermis, but are rooted in the dermis. The sweat gland are also originated from the epidermis, but invaginated in the dermis. The dermis consists mainly of the fibroblasts, the blood vessels, and there are three layers of plexus: a deep vascular plexus, an intermediate one, and a superficial vascular plexus. Epidermis does not have blood vessels. Now we can proceed to functions of the skin. In Introduction to the Skin, Gray's Anatomy writes, it is the largest organ of the body. It forms the entire external surface of the body and it is continued with the mucosal surface of the respiratory, GIT and urogenital tract. So Gray's Anatomy gives a list of functions of the skin which are not even aware of. What are the functions of the skin? First, it minimizes the potential injury of a mechanical, osmotic, thermal, and the photic environmental stresses. This is the most important functions of the skin. So it is something that it is for the protections. The skin is for protection. It is a barrier to the microorganisms. So it is a doorway not allowing microorganisms to enter into the body. It limits and regulates the actions of the heat and it is major sensory surface. So this is what very important that it help in the heat cold balance. There is a many more functions that the skin perform, that is absorptions and excretions of the other important function. Conversions of the precursor compound into vitamin D. That means uh, by exposure to the sunlight, our skin produce vitamin D. Good functional property enhancing locomotions and manipulations by its textures and physical structure. The back of our hand, elbow, fingers, and different designs. which stretch on flexions. Therefore, it is not only the joint and muscles that help in the movement, but even the skin help in the movement. So whenever you are treating a case of scleroderma, the skin become very tight. So most of time the patient comes with the very tight skin on the face, that is the scleroderma. It is something that the elastin of the skin has been disturbed. It is also important for the social communications and the facial gestures. So we are communicating with environment with the help of skin. The functions of instinctive behavior, for example, sudden fright and you start perspiring, or the goosebump or goose place or horripilation is also the functions of the skin. So this is what we need to keep each and everything. Whenever we are studying anything, we need to study the anatomy and the physiology of that particular part or organ. Then and then we go to the disease part, and then we have to understand what is the disease and how it represents to all of us. So the case was case of the psoriasis. So we are starting with the reading of the case of the psoriasis. Mr. Ase came on the 11th Feb 2002, age 25, young, unmarried male from a rich business family, joint family of two elder brothers. Both are married and well settled in the same business. He came with the complaint of the psoriasis. Hardly any part of the body was spared. It was a frightful sight. The scales and powder was just falling. The skin was absolutely red in color. This is known as erythrodermic psoriasis. The diagnosis is most important in our practice. He was shivering very badly and had covered himself totally. He said he was originally chilly, but not like this. This is too much. Did not want even fan or AC, refused to even remove his shirt. Since the last 15 to 20 days, the chilliness has increased tremendously because whenever the insulations of the skin has been gone, thermoregulatory mechanism has been disturbed and that produce a chilliness. He just could not tolerate cold at all. He said, I am feeling so bad and low that I actually thought of committing suicide. This is just too much. So this was the patient's feeling. And Dr. Burkar, what is your cravings and aversion? I do not want to talk about it. You asked me what is important for this case. I do not even remember my cravings and aversion now. You just give me the medicines. See how desperately the patient is in the pain of the psoriasis, and he asking that give me the medicine. So life history, he left study at the age of 17 as he was more interested in business. He is very ambitious. He is into family business of transport since last 8 to 9 years. He is very industrious, work the whole day, work much more as compared to his brother, work from the morning to the night, like to play, but has concentrated very much on his work and does not have time for hobbies or play. Why do you work so much? So this was the question by Dr. Borkar to the patients. The patient says that I am very ambitious and do not like losses in the business. Now the situation in the market is so horrible. Earlier we had a monopoly, but now since the last couple of years, many other players have entered in our field, and so there is a lot of competitions. If this continue the same way, then we will lose the grade, and this is my biggest worry. So this is what more anxious about the business. I have seen many of my friends losing a lot in a business, and I do not want to be like them. So I work very hard. I want a lot of money. I am very ambitious. His mother said, Doctor, he takes this very seriously and gets depressed easily. Ups and downs in the business are expected, but he works like a hell so that he does not lose anything. His brother also are working now. No one works like him. He has not parried or gone with the friends for a month together. So this is what how the person is. How did the complaint start? What happened the first? So this was the first question we need to ask in each and every patient, that how did the complaint start and what was the first symptoms? Okay. So the eruption has been there since the last 1.5 years, but they were never so intense and generalized as they are in last so many months. There were patches here and there, but since December last year, the eruptions have suddenly started to increase, and now since last 15 to 20 days, the severity is very bad. Why did it start suddenly in December? Is there any reason? What was the stress 1.5 to 2 years back? So this was the few questions you need to ask to the patients, how it is erupted, how it is started, and you need to ask. So patient says, I used to like a girl, a far off cousin of mine. She also used to like me, but due to some reason which I still do not know, she got married to someone else. Since that time, I have been feeling more depressed. I find it very difficult to get over it. I feel everything is lost. This is the only stress that I feel has affected me. It is only after this that this skin problem seems to have cropped up. So this is what in 2002, what we got right now after the learning the uh, GNM study. What GNM told about the psoriasis, there must be some separations conflict regarding the persons or loved one happen and that create a psoriasis. And what was the stress sir is asking? And he said that I like one girl and she got married and he feels that everything is lost. So again, Dr. Boker asked, what happened December? Again, the symptoms has been suddenly rises in December. So anything else that happened during in December that gives rise to the sudden psoriasis? The patient says, I am not very sure, but my brother got married in December and we had a small party wherein I had a small glass of wine. Next day onwards, my whole body started itching, and since that time, maybe this has increased, but I am not very sure. Again, this was his patient is giving the physical ailment that the wine causes this according to the patients, but it is not surety. What Dr. Borkar says, did anything else happen 15 20 days back to increase the scaling? The patient says, no, I do not think so. Now, can you please give me the medicine? So this is what the patient is in a hurry and patient is in desperate problem. So he is like this. But Dr. Borka says, so this is the case and we know the condition is history and how do we start? So if we have this much of a detail, then what to take into consideration and what is to be uh, given importance into the case. So first, the understand the case, the disease layer. So this is what very important aspect of the each and every case is. First, understand the case. Second, disease layer. The third, the miasm in mental and the physical plane. So you have to keep everything in these three process. Okay, so we cannot proceed before this. Do not jump to the symptoms and the rubric directly. Understand what is to be treated first. So this is what very important aspect. This is what given in aphorism number 3. Then analyze case as given in aphorism number 3. The knowledge of the disease, knowledge of what is to be cured in the patient, and then understand the case from the remedy point of view. So this is very important aspect of it. So what is to be cured in this patient? Now a depressions, a psoriasis, a chilliness, and the insecurity. What is to be treated in this case? What is the cause of this chilliness? This is due to the excess heat loss. The number of the cells generated is very fast. There is a lot of ATP loss, and so to cover up that up, the body goes into shivering to generate the heat, and there is a heat cold balance has been disturbed. This is seen in such severe case psoriasis as the cell life, which normally is 5 to 6 days, now comes down to the 2 to 3 days or even 1 day. So this is what very important. So what we have to treat? Either depression of the patient, the psoriasis, the chilliness, or the insecurity regarding the business. What is to be cured in this case? Now we have to take a definitive symptoms that no one can argue about. When there is a reason for symptom, it value decrease. So industrious and ambitious is not very much important here, but here it is a disposition. What is more higher up is his sense of insecurity. Because why this happen? Because of he has the insecurity. There is no reason for it to come up. Is this insecurity soric, psychotic, or syphilitic? So we need to find out that. What are the stresses that he went through? First, he got disappointment in love. Second, insecurity in the business. What was his reaction? Every time the sensitivity is there and the reaction is there. So you need to understand the patient as the sensitivity and the reaction. So if the sensitivity is there, then and then the reactions come, and the reactions comes according to the miasm he is suffering from. So if the person is in a soric state, the reaction will be soric. If the person is in a psychotic state, the reaction will be psychotic. And if the person is in a syphilitic state, the reaction will be syphilitic. So reactions gives you a good idea that how they behave, how they act. So reaction is most important, and that is what we have to taken into consideration. So here the two causes are there. One is the disappointment in love, and the second one the insecurity about the business. But what was his reaction to both situation? So reaction of the patient to any exciting factor is very important. So this is what Dr. Vijayakar has told us. So reaction here is passive. He feels everything is lost. Even in business also he feels if I will not work properly, my business will lose it, I will lose my business, so everything will lost. So here the reaction is passive. He feels everything is lost, there is a hopelessness. This is known as a despair. So reaction is despair. The next thing we the next thing, because very very desperate conditions, so he comes to a doctor that do not ask me anything about cravings aversion. If you give me a give me a medicine, give me a medicine. So that means what, he is in a state of so desperate conditions and a despair state that he wants the relief. So the next things that we consider is his chilliness. If the pathological symptoms is very intense and severe, then you can always take it. So very important aspect of understanding is this. If the pathological symptoms is very intense and severe, then you will take and can take it always. So very important of understand. So here in this case, we have to understand the cause, we have to understand the reactions, and we have to understand the pathological symptoms. So we now consider first the ailment from disappointment in love, that was one of the reason, plus ailment from disappointment deceptions. It was taken by the sir based on the process that he wanted to that girl to marry, and she got married to someone else. So he feels that he was being deceived. So that is what ailment from disappointment deception from. And reactions to this all the situation that I lost everything, that was a general rubric has been taken as a despair. Because the general rubric, if we take the general rubrics in the beginning, there is a less chances that we will miss out certain remedy. And the patient has tendency to go into despair. So despair is not the disease state here. you know he felt deceived. He did not know why that girl got married to someone else. For this skin conditions, he thought of committing suicide. He cannot recover from his disappointment, from his business loss, from his skin condition, and that is why this despair is syphilitic. He thought of committing suicide, but he had not done anything. Okay, and the patient is chilly. There are around 15 to 20 remedy that comes up, but on the basis of that, the remedy given was Soranum 10 single dose. The other remedy that comes up is arsenic, kali, naxomica, and sepia. So he is not indifferent like the sepia. The sepia is ruled out. He is not fastidious or positive like Natsomica and Arsenic Alp. Also, Arsenic Alp likes company. So, also it is ruled out. Kalis are very lazy and indolent and aversion to work. They do not like any kind of the work except for the Kali Kab, which likes only routine type of the work. It is given under industrious and desire for routine work. So on the basis of these dispositions, Sir has prescribed Soranum 10. Now come to the miasm. We know that at the mental level, he is in the syphilitic state. In the physical plane, the defense has been broken down, but there is no cracks visible. Psoriasis comes in the dermal layer. This is the third layer. Cells are formed in the last layer of the epidermis. Dermis has nothing to do with the cell production, but the stimulations of cell productions come from the dermis. So it comes under the psychosyphilitic miasm. The psychotic as there is a lot of flaking and the powder coming out, and syphilitic as the rate of production is very fast. Our cells are coming up and dying very fast. So this is what the miasmatic understanding of the psoriasis. The disease has taken over him, so he is going into psychotic to the from psychotic to the syphilitic miasm. Now we have the remedy. So what do we expect now? What to be taken into consideration as a follow-up? What should we go away first? So in follow-up, he did not came for the month. He just called up and said that he is better. One day he said, why are you doctors not treating me completely? Do you want to lengthen the treatment for a commercial purpose? So this was the questions of that poor patient. Just imagine he has contacted us for 1 month. He has contacted us after 1 month and he is speaking like that. Patient says, I think you do not want me to get all the right completely so that you can continue treating for me years together. Dr. Borkar says, what is this? Is it a good or bad science? This is a good science. Why? Because desperately a despair patients went into this insecurity. That means he is transforming from the syphilis to the psychosis. He has started doubting on the doctors and he is now come from the syphilitic to the psychotic state. His hopelessness has now been replaced, but the doubt on doctor has been increasing. This now also tells us that the desire to live and love for life has returned. So initially he thought of I am committing suicide, but now he thought that you doctor don't treat me very fast because of commercial purpose. So that is what the things has been changed. Still further, we gave him predictions. We told him what is going to happen, what should go first. He's shivering. No need to tell him that his despair will also go. This is the patient has to come and tell us that his depression is better as depression is not the disease for him. Next, erythema should reduce first and then the exfoliations. Why? The scaling is at the epidermal layer. In psoriasis, the irritation is at the dermal level and exfoliations at the epidermal layer. Unless these dilated loops of the blood vessel do not decrease, the exfoliation will not go. Therefore, the scaling will go later on. First, the color of the skin should change from above downward. So, we have to tell him that his leg will be the last to improve. His face, neck, shoulder, etc. will improve first. So when this actually happens, he is amazed and he will not complain if his leg is bad. Legs are bad. So this is what very important. The color of the skin should change from above downward. This is very important in psoriasis. Second, fall of the flags are still there. The color of the skin is better. The scales are now dried and bigger and not falling off easily. This is the psychotic phase now. The most important area to look for are the behind the ear and over the elbow. If the lesion remain here, then there are chances of recurrence. So whenever you are treating psoriasis, all the symptoms has gone, but you will find that there is a crack behind the ear and there is a lesion at the elbow level. Be sure your patient will end up with the recurrence. So this is what you have to keep in mind. His legs are still red in color. So this is what the most important to understand the follow-up in this case. The third follow-up, the flakes are now much smaller in the size. So now psychosis has been reducing, his hair fall is better, the legs are still bad, the toenail have just started to get worse. Earlier his toenail were not bad, but his fingernail were bad. These are now better, the nail will be the last to improve. Again, nail will be the last to improve as this appendage of the skin and they originate from the epidermis and they too will improve from the above downward. That is, the fingernail will improve first and then the toenail. So this is very important aspect of understanding. So whenever you are treating the case of psoriasis, the skin has been improved, but nail has been decreasing in the quality. So wait and watch because nail has to improve the last. And again, it is also from the above down. So the fingernails to are improving and the toenails has been worsening. So this is the follow-up. The fourth follow-up, the now slowly normal skin is seen, which was not seen before at all. He is now going to the psora. He now has developed a macular rash. If the hypopigmentations remain, again very important, if the hypopigmentations remain, it is bad because it has a deeper level. So it is the suppression. So most of time whenever you are treating the psoriasis, the patch has gone and there is a hypopigmentation. Mind well, the patient will again comes to you with the recurrence or might the patient go into a state of suppression. If at all present, it should be transient. See, very important, if the hypopigmentation is present, but it should be transient and it is again replaced by the normal skin color, then you have to wait for that. One fine day, his dog had expired. He was very attached to him. The dog was the only friend he had. Also, that girl had come to the Nasik. Moreover, he had also applied some deodorant. So, the second dose of Sorinum has Tenem was repeated. So, whenever the patient is hampering the process by applying something over the skin, then you have to repeat the dose. After the second dose, he is now on the sauropsychotic phase. The legs are still bad, his fingernails have improved, and his toenails are bad. Initially, only his great toenails were bad. Now, all his toenails are affected. Normal skin color is coming up along with the normal skin everywhere. The legs have now started showing improvement. So, the in follow up, the normal skin color has to be established. Now only simple disquamations is present. This is purely psoric. The legs are now becoming normal. The toenail have started to improve. He has come down from the syphilitic to the psoric phase in just 7 months. Coconut oil or Vaseline can hamper treatment by obstructing the extractive mechanism of the skin. It is not a must that it will hamper, but it can hamper. So many a time in our practice, most of the doctors, even I myself, advise many a time to the patient that if you have a more itchings and a dryness, you can apply the coconut oil. But what sir has said, it can hamper the excretion mechanisms of the skin, but not in each and every cases. So see, look at the case of the patient. But as per Dr. Vijayakar, do not apply anything over the skin. So that will hamper the process of healing. Again, the question is why the TNM was given to the patient, because TNM was given because the sorinum is a nosode and nosodes are known to be dangerous in the lower potency. That's why, and that is the reason they are very deep acting, and that is the reason Dr. Prafull Vijayakar has given sorinum in TNM potency. Now, with a few short cases, I will try to highlight the importance of the skin from analysis or prescribing point of view. So in this case, what we have to observe that if hypopigmentation remains for a long time, that means it is suppressions. Again, nail has to improve the letter. The most important area to look for psoriasis is the behind the ear and the elbow. So if lesion remain there, there should be warning signs that you should change the medicines or you should be looked that Either patient may end up with the suppression or patient is not curing himself. And again, the color of the skin should change from the above downwards. So these are the follow-up criteria specifically in the skin disease. Another case, the case 2, the patient has a thick keratosis with the deep cracks since the last 5 years. Thus, he has a SORA plus psychosis plus the syphilis. So this idea gives us that the thick keratosis with the cracks is something that SORA plus psychosis plus syphilis. Crack used to bleed a lot, so he would wear shoes even at home and walk about. After giving sulfur 201 dose, his constitutional remedy, within 6 to 7 months his toe were better by almost 90%. The improvement started within 3 weeks itself. Cracks totally healed from the beginning and now were getting leveled. From June 96 to the April 97, the patient was absolutely in status quo. His two were not showing any further improvement. He was given sulfur in 200, 1 m, 10 m, 50 m, cm, and some other remedy also. But no, there was change at all. So many a time it happens to with all of us also. Then in relations of the relationship of the remedy related to sulfur, I came across the totality, that means the sarsaparilla. The patient was given 1 dose of sarsaparilla and he was much better in 15 days only. That is, the patient has gone into the complementary of the sulfur. Very rarely chronic disease is cured with a single dose only. Important understanding, specifically in skin cases. Very rarely the chronic disease is cured with a single dose only. Another case, the case 3, the case of the male with the 40-50 small warts on the face. It is a bread and butter for the all homeopaths. The skin also gives us a sign and a clue. All his warts were only on right side. This is the physical general. He was just engaged and was going to get married in another 1 and 2 months. He developed this wart after his engagement. The girl was in the village, so she could not see the boy after their engagement. He was going through some anxiety as he had no jobs. He desired warm food. I do not remember the whole case. This is what the process. With the right-sidedness and the desire for a warmth, Lycopodium 201 dose was given, and all the warts were gone within 15 days. Before his marriage, his warts went off and the macules remained, which also went off little later. Just like Sora is the mother of all disease, macule is mother of all skin disease. So this is what very important understanding. Whenever you are treating the whole disease, and if the macules comes, then you will be sure that he is going to be healed soon. Now let us go through some basic skin terminology. If we know this only and not the diagnosis of the condition that we are treating, it is enough in treating most of the skin conditions. So it is very important to know the diagnosis also, and we are sure of 70 to 80% of skin conditions if we know this terminology. So what is the macules? Black color lesions less than 2 centimeter in diameter, not raised above the surface of the surrounding skin. Usually, all skin conditions start with the macule. There is a patch, the macule more than 2 centimeter in diameter, it is called the patch. Patechi, if the macule is because of blood or a pin size, it is called patechi. Mostly you can find out in hemorrhagic purpura, the patechi, or sometime in some viral fever, you can find out the patechi. The papule, the small solid lesion less than 1 centimeter in diameter and raised above from the surrounding skin. The nodule, a small solid lesion more than 1 centimeter in diameter and raised above from the surrounding skin. Vesicle, if the papule contains fluid, if it is known as vesicle or a blister, a fluid-filled small lesion less than 0.5 centimeter to 1 centimeter raised above the surface, it is called vesicle. The fluid is visible and translucent. Bulla, a papule containing fluid measuring more than 0.5 centimeter to 1 centimeter raised above the surface, it is called bulla. Pustule, the presence of the pustule does not necessarily indicate the infection. It can be just lymphocytes. Vesicles made with lymphocyte is a pustule. Abscess, a pustule greater than 1 centimeter is an abscess. The plaque, it is 1 centimeter to 2 centimeter flat top raised lesion, not very deep. And the cyst, a soft encapsulated raised lesion filled with the semi-solid or a liquid content, and it is psychotic in nature. So these are the few terminologies which we have to understand that the patient is suffering from certain skin disease. A macule start and form a patch. It is raised above the surface and it is solid and it is a papule. If the papule enlarge, it become a nodule. If the nodule enlarge, it become a tumor. If papules are flat top, it is a plaque. The disease will usually disappear in the reverse order only. If the raise above the surface but not the solid, with the fluid content, it is vesicle. If the pus, it is pustule. If enlarged in size, it become a bulla. If it has capsule, it become a cyst. So these are the follow-up criteria whenever you are treating the skin disease. Erosion, an area of the skin denuded by the complete or partial loss of the epidermis, it is called erosion. The ulcer, an area of the skin from which whole of the epidermis and at least the upper part of the dermis has been lost. This can be bleed because dermis has blood vessels. If we wish to understand how skin conditions develop from the homeopathic point of view, that is from the psora to psychosis to the syphilis, then development of the eczema is the best example. So here how the disease has been traveled from acute eczematic condition to the chronic as a miasmatic progress. So in acute eczema, it starts with the redness and the swelling, usually with ill-defined margin. Then it develops papules and the vesicles and rarely large blisters. Then there is the exudations, cracking and the scaling. There is psychotic. This cracking is initially at the epidermal layer. It is a psoric in nature, crack without bleeding, because when it goes deeper into the dermal layer, there must be a bleeding spot because dermal layer consists of the blood vessel, whereas in epidermal there is no vessel. So crack without bleeding is epidermal, and sir has given it is in a psoric state because that is a dead skin and this skin has been went off normally, so it can produce a crack. Chronic eczema, it may show all the above features, but now it is less vesicular and less exudative. There is now thickening, the lichenification, the dry leathery thickening with increased skin markings, secondary to the rubbing and the scratching. Then the fissures, scratch, marks and the pigmentation start and appearing syphilitic. So when eczema goes, it has to go into similar fashion in a reverse order. Thus, if we study skin from this point of view, then I feel it can be of immense practical utility in our day-to-day practice. So today's approach of the skin disease is most important to understand how the follow-up is important and how the lesion has been reducing in each and every cases. So look into this process and you will get the idea. So go to your clinic, look at the patient and understand how the patient is reversing in your cases. So that's all for the 2 days. So we conclude our day today here. We will continue the sessions from tomorrow. Thank you for being with me in this journey of reading Dr. Vijayakar sir's book, and we are getting the wisdom of Dr. Vijayakar sir's from this learnings. Thank you all. Happy Mahashivratri to all of you. May Lord Shiva bless you to heal all the patients who came to syphilis because Lord Shiva is the god of syphilis. So happy Mahashivratri to all of you. Thank you. Thank you all. Thank you all. So we conclude the day today. Thanks a lot.